Hospitals in Northern Ontario are scrambling to recruit more doctors as the healthcare situation there becomes dire. Right now, more than 2 million people in Ontario do not have access to a family doctor. And now the Ontario Medical Association is calling on the province to please come up with a plan. So joining us from Thunder Bay this morning is the president of the OMA, Dr. Andrew Park. Welcome to your morning.
Good morning.
Can you describe for us what the situation is like in the hospitals and primary care clinics in Northern Ontario as a result of these trends? And I heard a description that was helpful to me, and so I'll share it with our viewers. And they described that landmass in Northern Ontario as the size of France, so a European country's worth of people who are struggling with their health care.
Yeah, I mean, it's at least that size, plus it's only got about 200 to 250,000 people. So the 90% of our population does not reside in the north. It's a very small fraction of the population. So that provides some inherent challenges to providing healthcare that we just don't face in more urban areas.
Yeah, the shortage has worsened over the years. Hospitals struggling to recruit new staff. It is difficult to get people to move up to the north where it's remote. Communities in the north are trying to hire right now 350 new physicians. What are the biggest challenges when it comes to trying to get doctors to move up there?
Well, like a lot of communities that are smaller, it's a challenge for newcomers to Canada and new graduates from more urban areas to adapt to life in this area. This is why a school and a program like Northern Ontario School of Medicine University, which has graduates that have a very high retention rate in the north, are very important programs. But this has been a very big challenge for a long time, and it's only gotten worse post-pandemic.
Yeah, a lot of communities in the north rely on nurse practitioners for their primary care, but nurse practitioners are not always covered by OHIP in this province. What does that create?
Well, the bottom line is that, as you pointed out earlier in the clip, that there are 2.3 million Ontarians without a family doctor. That challenge is disproportionate in the north. They face inequities around chronic illness management and particularly around mental health and addictions. And that's where access to primary care, access to preventative care is a really important factor to saying, how do we ensure that they have a healthy trajectory long term?
Yeah, so how do we ensure that?
Yeah, so ensuring that there is a stable, group of family doctors as well as nurse practitioners. Team-based care would be really valuable in the north to make it so that everybody has a medical home. They know where to go when they need care, as opposed to having to rely on emergency departments, in some cases could be hours drive from where they live. Some of the towns up here only have one doctor in the entire city. And so if that doctor is away or if the emergency department is closed, then you're looking at a 3 to 5 hour drive in some cases, and that would be a short drive. So, and that's if you can drive and you don't require a plane. So that's really where we're trying to put our efforts.
Yeah, I heard one doctor describe it as the fact that they're trying to provide emergency care, but also to provide regular primary care at the same time. They're trying to do double duty, and there's only so many of them. The Ontario College of Family Physicians is warning that by 2026, about 4.4 million people in Ontario just will not have a doctor. That is double the current number in less than double the time. So what are you looking for from the province when it comes to tackling the problem of providing people with primary care?
Yeah, so just a renewed focus on primary care is massive. As you pointed out, 4.4 million would be devastating. I always like to use the analogy that if 4.4 million children were without a school, we would think of that as a massive crisis. This is akin to that. Yeah. We want the government to ensure or make provisions that every Ontarian has a family doctor. We're very big on promoting team-based care and using allied healthcare to ensure that the capacity of the system grows, and we provide care in a very coordinated and integrated fashion with other team members, including nurse practitioners, nurses, social workers, dietitians, physiotherapists, pharmacists. Because when you go to see your family doctor, you don't always need to see your family doctor, but there may be other allied healthcare workers that can provide that care. But as long as you're under the supervision or a coordination of a family doctor, that improves care overall.
Dr. Park, I think this is our first time speaking to you as the new president of the OMA, so thanks for coming on this morning.
Thank you for having me. Appreciate it.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.